think patients are starting to see it. They're starting to come in demanding it, wanting it. I feel like patients a lot of times understand better why a ceramic implant is more valuable than a titanium-based or a metal-based counterpart. So it kind of sells itself, I think.
The value, I mean, it sells itself. If you look at the data and you're looking at the research, the way the tissue responds to the zirconia versus, say, titanium, it seems like the tissue runs from it, or the bacteria is attracted to it. And zirconia is the tissue likes it, the bacteria doesn't really hang out there. So it's white, it looks pretty, it's aesthetic, it's easy to use, and it fits right into the whole biological concept. Easy. I promote being more biological or holistic, so I would say most people do come with some knowledge. However, I did buy this practice, and this practice was a mix of all types of patients. So it's easy for me to talk about it and kind of lay it out, but it takes a little bit of educating the patient because you're giving them something new and different. So I would say that that's pretty normal, but not hard to do. Easy stuff.
So we're still a titanium practice. We do both. So I give the patients and I tell them like, hey, this is the best. We have the meridian charts up. We have posters up, the ceramic implants all around each operatory. And I tell them like, this is the best that you can get. Like if you truly care about the long-term health benefits, ceramic's the way to go. Titanium is going to work. It's worked for years and years and decades. But when we start seeing, when your health starts to decline, things in your mouth are going to start declining. So do you want to prep for that, or do you just care about now? You know, if you're making an investment, make the investment for the rest of your life.
Sounds to me like perhaps long term, might it be a better financial decision to make a bigger investment up front?
100%. The financial decision up front, yes. The problem is when patients are in pain, they can't think about long term. So I explained it to them like, look, we can do this for you, but you will at some point have trouble with this in your lifetime. Titanium is biocompatible, but how biocompatible is it to a material that we know is 100% biocompatible? Can see the difference, can feel the difference, and if your health starts to decline and you're hospitalized, or you're in a hospital, you can't brush your teeth that much, well, the titanium that you have in your mouth is going to start declining. Now, if you can actually, we can prep for that, even if you're in your 50s, we can prep for when you're in your 80s and 90s, you will enjoy your teeth, or then you're going to get to that age and become miserable.
I don't have to. They see the value I have in my office when I'm doing a consult. I have in my hand, here's a titanium implant, here's a zirconia implant. Which one would you want in your head? It's that simple.
The reality, the zirconia implant have a good advantage. Why? Because the people don't realize most of the titanium implant is not pure titanium. It's an alloy. When I say alloy, it's a combination of metal, and the combination of metal is titanium, aluminum, vanadium. And even if the implant is not is a pure titanium, like a type 4 titanium, the component go over the titanium implant is type 5, is the titanium, aluminum, vanadium. For that reason, basically, you don't want aluminum and vanadium in your body, because aluminum is related to Alzheimer, vanadium is related to allergy. You want to be the best as possible metal-free.
We don't sell to our patients, we really educate them. We'll let them know what the benefits of the ceramic implant system versus the titanium. We educate them about the potential of periimplantitis and potential metal sensitivity with the metal implants, and long-term corrosion and inflammation associated with metals in the mouth. So we'll let all our patients decide what is best for them, and we kind of guide them making the best health decision for themselves. So education is always kind of part of making kind of the right informed consent. So the patients that do kind of end up coming, yes, they've done their research ahead of time, and they've gotten different level of interest and education about, patients are more interested about their health and their well-being. So those are the patients will tend to choose metal-free dentistry and ceramic implants in general.
I mean, the proof's in the pudding with the pictures. I take a ton of pictures. You know, I have pictures of what teeth look like with root canals and the gum tissue, same with titanium implants, and then tons of pictures of the zirconia SDS implants. And the gums just look so healthy and pink and plump, and you know, it's just a prettier product too. People don't want, you know, metal or gray in their mouth. They like this bright white implant. I think the pictures and really having really good testimonials from my patients for them to see is very helpful.